Hi, and welcome to Healthcare Uprising's 15-minute fix. Today, we've got Molly Greenwald with us, resident expert on Medicare, and I can say friend of the pod. She's a
Yep.
return guest, number 5 episode, Jeremy?
Episode number 5 from February 11th.
Yeah, when we were like baby fledgling podcast, and now we're like somewhere in the 40s. So
I love it.
Back when we only thought we knew what we were doing.
yeah, so excited to have you back, Molly. What have you been up
Thank
to?
you. Thanks for having me. I'm super excited to be back.
Cool. Well, like we said, resident expert on Medicare. When you were with us back in February, we talked about a lot about long-term care.
Yes.
That episode is still one of our most popular episodes.
I think it's
because
two
it can be
download.
so challenging to navigate that. And that's something that I really have dedicated my life to trying to help people navigate it because it just can be very overwhelming.
Yeah. So
Any information you can get that will make it easier to understand and make it easier to navigate for people, I'm happy to supply it.
Yeah. Awesome.
There you go.
So for today's 15-minute fix episode, which is new-ish, we've only had a couple so far, but wanted to bring you back because your long-term care episode did so well. And, there's a lot of people that don't understand Medicare, long-term care, Medicaid, all those things, right? Government programs,
Right.
all those things are just complex. So let's start with
You
most
mean
easiest question.
they don't make them easy for you? Is that what you're
No.
trying to tell me?
Not really.
No, not so much.
Right. It's hard.
Layered, added onto, and yeah, it becomes really untenable. And so I'm going to reel it in for you. How about that?
Awesome.
Nice.
So, Molly, tell us what exactly is Medicare Part A and Part B, and what are the
Absolutely.
differences?
You got it. So Medicare Part A is Medicare. First of all, you have to age into Medicare. You get it when you're 65 and older. And essentially for Medicare Part A, if you have worked more than about 10 years in your life, it is free for you. So you're paying into those taxes, and then this is your benefit as you become an older adult. So at 65, you have the option to get Medicare A and B. Medicare A covers all of your hospital insurance. So if you're in an inpatient stay in a hospital or a skilled nursing facility and you're, only anticipated to be there for a short amount of time to recover, get better, and your goal is to go home, or even if your goal is to go to another long-term care facility, while you're in that acute stay, Medicare A covers that. So Medicare A has no monthly premium because you've paid into it your whole life. And so that's great. That's really awesome for our elders. Medicare Part B covers outpatient care. So when you go to the hospital, your stay at the hospital is covered under Medicare A, which means all of your nursing services, all of the things while you're physically in the hospital. But your provider, your physician, he gets paid from Medicare Part B. And so Medicare Part B covers outpatient care. It covers physician visits. It also covers things like durable medical equipment. If you needed a wheelchair or if you needed a pair of crutches or something like that, those kinds of things would be covered under Medicare Part B. However, Medicare Part B also has a premium. It has a monthly premium. Right now, it's around $175 to $185 a month, depending on your income. So there is an income differential for what you're going to pay for Medicare Part B premiums. But you also have a small annual deductible. It's around $257 a year. So your annual deductible, you meet that, and then you continue to pay your premiums. So think of it like that. Medicare A covers you while you're in the hospital. Medicare Part B covers your provider and some of the extra things you might need, preventive services like vaccines, those kinds of things, as well as durable medical equipment.
Okay. I learned something new today.
Okay.
Already.
Yes.
That was quick.
The 10 years, the minimum of
Yeah.
10 years. I didn't know
Yeah.
that.
I didn't know that either,
Average
actually.
10 years. Usually it's about 10 years you are kind of vested. And I may not be 100% correct. I mean, definitely it's 10 years, but it's around that. You've paid into your taxes and then you get that benefit back.
Okay. So I have
Yes.
here's a question. This is
Okay.
also, I don't know the answer to this. What happens if you haven't worked? Let's say been a homemaker and you've never worked your whole
You're
life.
not
I mean, I'm sure
eligible.
that happens. Probably not as much
Does
anymore,
happen.
but
It does happen. When I was in the nursing facility, I mean, if you look at the generation of people that are aging into Medicare now,
Mhm.
they're calling it the silver tsunami. I'm not sure if you've heard that term. They
Wow.
are older, and there are people in that age group that were homemakers that didn't, moms that stayed home and raised their
Mhm.
children, and that was their job, and so they don't qualify for Medicare. So if you've
Really?
never had a job or if you didn't have a job that was more than about 10 years, you don't qualify. And we definitely saw that while we were in the facility. So a lot of them, if they have the low income, can get on Medicaid. But again, that's just depending on an income level.
Okay. Yeah. My head went immediately to, okay, if they haven't worked, here's two likely scenarios. Either they're like super uber rich, right? And
Right.
money is no object, and who cares if they even have Medicare? They're going to pay cash for everything. Or two, they're probably low income and therefore they're going to qualify for Medicaid.
Exactly.
Okay.
And so I don't want to, misspeak. If there is another way for them to get Medicare A, I don't know it. I just know what I know. But if somebody
Mhm.
else can give us some more tips on it, then that would be great. But what I've dealt with in the past is people that didn't qualify for it.
Okay.
Well,
Got it.
so if you haven't worked at least 10 years, we just don't do anything for you. That's a very
Because
American sentiment right
you're not paying into
there.
it, right?
Very American.
Exactly. You haven't paid into the benefit.
Right.
Right.
Exactly.
I mean, I look at my pay stub, right? And I look at, the pay
All the
stubs for
things.
like my husband's company's employees, and there's that line for Medicare.
Yes.
So
It's all coming out. Exactly.
henceforth government health programs.
Government help.
It's not really free per se.
No.
Nothing ever
No, it's
is.
not free. We don't have socialized medicine, that's for sure.
No.
No, we do not. So,
Yeah.
and this wasn't actually a question that I had kind of prepped you for here, but it's gotten me thinking because there is also, and I think we need to clarify this. There is original Medicare, which is part A and part B is part of original
Correct.
Medicare, and then you can also get into a Medicare Advantage plan,
You
which is
can.
offered through like an Aetna or a Humana or a Blues or a whatever,
Right.
a Cigna, and that's different, right?
Absolutely. Excuse me. Yes.
So
So
let's talk
Medicare
about that.
Part B is Medicare Advantage plans, just like you said, Medicare Humana, Medicare United Healthcare. They're an Advantage plan. It is a private insurance alternative to the original Medicare A and B. So basically, what it is you're giving your benefit to that company, and then they're going to come back and give you some kind of a bundled coverage. And a lot of time that includes dental, vision, hearing, and prescription drug coverages or some, mix of those. And that's what makes it appealing to people is because if they have high costs of prescription drugs, they want to bundle it all up. However, you have to be buyer beware when you look at Medicare Advantage plans because not all Advantage plans are contracted with every physician in your community. So that comes to the point where you might have to change physicians and you might have to get extra prior authorizations if you need a referral for somebody like you go to a primary care provider. You can't just call up the dermatologist and say I have a mole I want you to look at. They have to write you a referral, which might mean you have to go back into the office for another copay. So all of those things are a little bit different with Medicare Advantage plans. The other thing coming from the long-term care world is they do have a little bit of autonomy over what you can they have a little bit of autonomy over your medical decisions in the sense of they can cut off your stay in a long-term facility based on kind of algorithms of what they feel is appropriate for somebody that has a hip fracture or things like that. So I always just say, be aware and be an advocate for your health and speak up if you feel like you need more care and your medical insurance might be saying, maybe you're done, or maybe we're not going to cover that. You need to be kind of that squeaky wheel and you might be able to get some traction.
Yeah. So somebody can. I'm going to use my mom as an example. Okay, so
Go
she's
right ahead.
83. She's actually on a Medicare Advantage plan. But she could have chosen to just get original Medicare Parts A, Part B covered through that, and Part D, right, which is
Correct.
for prescriptions,
That's right.
and you have to enroll in that separately.
Yes.
Okay,
Yes.
unless you go into a Medicare Advantage plan where Part D pharmacy is inclusive of the benefits.
Exactly. And so I
Okay.
have a quick analogy and I will go through it quickly. I know this is the fix, so it's only 15 minutes, but let's break it down. Let's look at Medicare as a restaurant offering. Okay. Medicare Part A is your basic buffet, right? It's a basic buffet at the restaurant. It comes with the essentials, but it doesn't come with everything. So you can walk in, you can eat the basics, bread, salad, soup. Keep you alive, but it's not the full experience. It covers your hospital stays, your skilled nursing care, hospice, and some health care. But it's usually free, but it doesn't always cover everything. So that's where you have Medicare Part B, the a la carte menu. So the a la carte menu are the things that you want or need extra. You want to pay to see the doctor. You need to get a medical test. You need to get blood work. You can get more personalized options from that than just to the buffet that you would normally have. So those are things, but that does come at a cost. So you have those monthly premiums around $175 a month. And then you get about 20% co-insurance when you do the Medicare Part B. So then you have Medicare Part C, and that's the all-in-one combo meal. That's like, I'm going to the buffet, but I'm going to get some dessert from this a la carte over here, and I want this special dish, and it might come all bundled, but then they might say, yep, but you can only have this much of that dessert. It's not a free-for-all. So that's kind of like your Advantage, Medicare Advantage plans.
Got
Um,
it.
and those are gonna, cost you a little bit more. And then Medicare Part D is like your drink plan. So if you've ever been on a cruise and you get that all-inclusive drink package or something like that, you may just be drinking soda, coffee, or tea, or you may decide you want, premium top shelf liquor, whatever it is. Think of like your medications, and that drink plan or that prescription drug plan will help you kind of cover all of those costs that you need in that and keep it more reduce your prices so that it's manageable for especially our older population. I don't know if that
Okay.
helped.
So it sounds like you got to be careful with those advantage things because if you're going to be someone who's going to need long-term care, it sounds
Yes.
like they're going to cut you off at some point.
So
So you got to
just
be
a
careful with that.
reminder, Medicare does not cover long-term care. It only covers acute care, which is like
Oh,
immediate
okay.
care, right? So long-term care can be covered by Medicare or Medicaid, but not Medicare. Medicare is just acute.
Mm.
Think of it as like a hospital stay, but you're going home, or a skilled nursing stay, whereas you're only there for rehabilitation and then the goal is to go home. Medicaid covers long-term custodial care.
Okay.
A lot.
So Medicare is never the long-term solve
Never,
anyway. Never.
never. And so
Okay.
if you were
I just learned something
in,
else.
yeah, so just to wrap it back up with my previous episode, if you're in a facility, your Medicare A is paying for your acute stay, the short-term stay while you're doing rehab and you're progressing to get better. It's paying the physicians that care for you. And then their goal for Medicare A is for you to go home and, do continue outpatient or whatever you need. If you have to stay
Okay.
in the facility, you might need to apply for Medicaid, which is more custodial care.
Or you
And
have
that's
to pay out of
also
pocket
Or you got to just
right.
pay for it.
if you don't qualify.
Exactly. Right.
Okay.
Especially
Okay.
now with Medicaid, cutting back, you may have to pay out of pocket.
Which honestly, not a lot of people can afford it.
Yeah.
No, it's
So what
Super
expensive.
is
expensive.
so what does that mean, right? Oh my gosh, we're gonna need another 15-minute
We
fix
might need another
episode.
we
That's
might
why we
need
got to do a
another
lot of these.
15
Yeah.
minutes. What it means is people are going to have to get creative. There's a real drop in the amount of caregivers that people have, like our elderly. They don't have as many caregivers. People are going to have to step up and really care for their family members because they're not going to be able to afford to send them, to a facility. They may have to bring them into their homes. I mean, that's the
Hmm.
biggest impact we're seeing right now.
Yep, I would agree with you. And then that would mean that paying for home care,
Yes,
nurses, and staff, I would see probably increasing. Um,
absolutely.
People building in onto their homes, multi-generational.
Yes.
So that could be good for general
Multi-generational.
contractors.
It might be good for a general contractor, absolutely. I could talk about this stuff all day because I'm in it, but there's definitely a lot coming down the pike with how things will transform in terms of
Mhm.
nursing homes and how we care for our elderly because
Yeah.
there's so many boomers that are aging into Medicare. I think over the next 4 or 5 years, there's going to be around 4 million people turning 80 or something like a real
Yikes.
huge number.
Wow.
Yeah.
The Medicaid cuts and the impacts of that are pretty. And when I say that's good for general there's more cons than pros. Like, let's just be
Oh,
honest about
yeah.
that.
Yes,
I don't want to
absolutely.
lighten that by any means, but yeah, that's
Yeah, right.
concerning.
Right when we need it most, they're cutting it.
Yeah.
That's a little frightening.
Okay. So I I think we covered all the things. And we talked a little bit about Part C and Part D. We talked a lot about Part A and Part B. Hopefully everyone understands kind of, and what we should include in the show notes too is a link to, like, I have a nice graphic of what each of these 4 things mean, Part A, B, C, and D, and how they kind of play together. Anything else before we wrap up?
I feel like I understand this way more.
Good.
Yeah, the biggest thing is just to speak up and be your advocate, no matter what your insurance is. And having somebody with you, if you are going to a medical appointment you don't understand, just make sure you're involved 100% in your own healthcare. And really, that's the number one thing you can do.
This has been a Shut Up production.
Shut up!